Hello everybody. In this lecture, we will be talking about acquired immunodeficiency syndrome, also known as AIDS. AIDS is a disease that is caused by the human immunodeficiency virus or the HIV virus infection. Here, when the HIV infection occurs, it leads to acquired immunodeficiency syndrome or AIDS. And this mostly occurs if the infection is not treated. Generally, the HIV attacks the body immune system via CD4 receptors on T cells. And when treatment is neglected, the T cell number is significantly reduced. And this leads to a greater possibility of other infections occurring. Also, there can be occurrence of infection-related cancers as well. And all such infections that occur due to a weakened immune system are considered opportunistic infections. Immune suppression can occur over the time due to this HIV infection, and the body cannot fight off the infections and diseases. And these opportunistic infections or cancers take advantage of this weak immune system, and this is what is the signal of AIDS. And as a matter of fact, this is the last stage of HIV infection. As of now, there is no effective cure for HIV infection or even AIDS, but there is some proper medical care that can be provided to help control the HIV infection. And this medical care is what is known as the antiretroviral therapy or the ART. Talking about the different stages of HIV infection, there are three stages. The stage 1 is known as the acute HIV infection, which occurs within 2 to 4 weeks of infection with the HIV virus. Here, the symptoms are generally flu-like illness, which may last for about a few weeks. Next is the stage 2 of HIV infection, which is commonly called clinical latency or HIV inactivity or dormancy. This may also be known as asymptomatic HIV infection or chronic HIV infection. Here, the virus is still active, however, it reproduces at very low levels. And in the stage 2 of HIV infection, there are no symptoms or sickness observed. In the non-ART or ART cases, you can observe that the infection can last for about a decade or longer. Meanwhile, in the ART cases, this may be a stage in which can go on for like several decades. However, only in the non-ART cases, you can observe that there is still transmission of HIV happening. And at the end of the phase, there is viral load that starts to go up. And the CD4 cell count or the T cell count begins to go down. Finally, we have the stage 3 of HIV infection, that is the acquired immunodeficiency syndrome or AIDS. This is the most severe phase of HIV infection, and it is mainly due to the badly damaged immune system. And here, due to this badly damaged immune system, we can see an increasing number of opportunistic illnesses, and where a patient without any treatment can have a survival of only up to 3 years. The common symptoms of AIDS include chills, fever, sweat, swollen lymph glands, weakness, and weight loss. Apart from this, it would also be characterized by various other symptoms associated with the opportunistic illness that has occurred due to AIDS. So, finally, the CD cell count will reduce to less than 200 cells per millimeter, and there is a very high viral load that is observed. And it is at this stage, a person can be highly infectious as well. Now, talking about the morphology of the HIV, it is roughly spherical with a diameter of about 120 nanometers, and in general, it is as much as 6 times smaller than a red blood corpuscle. HIV virus will generally have two copies of positive sense single-stranded RNA that is tightly bound to the nucleocapsid protein P7. This ssRNA codes for the virus's 9 genes, and this RNA is enclosed in a conical capsid that is composed of 2000 copies of the viral protein called the P24 protein. And the genes associated with the ssRNA generally code for enzymes that are required for the development of the virion, and these enzymes are the reverse transcriptase, protease, ribonuclease, and the integrase. Furthermore, this capsid is enclosed within a matrix that is composed of viral protein P17, and this matrix ensures that the virion particle integrity is maintained. All of this content is surrounded by a viral envelope that is composed of a lipid bilayer. Generally, this lipid bilayer is derived from the membrane of a human host cell, and therefore it contains proteins from both the host cell and also a relatively few copies of the HIV envelope protein, which is a cap made of 3 molecules of glycoprotein, that is GP120, and a stem consisting of 3 molecules of GP41 or the glycoprotein 41 proteins. And here, these proteins are the ones that anchor the structure into the viral envelope. And cumulatively, the HIV envelope protein is a characteristic feature of the HIV. And this is the one that is responsible for all the viral interactions with the host and also for recognition as an antigen during diagnostic processes. The HIV envelope protein is encoded by the HIV envelope gene, and this allows the virus to attach to a target cell and fuse the viral envelope with the target cell's membrane. Thereby, it facilitates the releasing of viral contents into the cell and initiates an infectious cycle. Talking about the transmission of HIV, generally it is transmitted through the body fluids. And the body fluids here are the blood, semen, vaginal and rectal fluids, and breast milk. You should always remember that HIV does not spread in air or water, or even through any casual contact. So this is something that has to be taken care of, because there is a misconception that HIV spreads through air, it spreads through water, or it even spreads through casual contact, like shaking hands with somebody with HIV infection and things like that. So please don't make such mistakes during examination and stick on to the fact that HIV is transmitted through body fluids like blood, semen, vaginal and rectal fluids, and the breast milk. And talking about some ways in which HIV can spread from a person to person, it can be spread through vaginal or anal sex. The most common route for transmission is this kind of sex, and especially it is commonly seen in men who have sex with men. So homosexuality plays a crucial role in transmission of the HIV virus, and also sharing of needles and syringes or other items for injection of drug can also be a crucially important factor for HIV transmission. Then we have sharing of tattoo equipment without sterilizing between the uses, or during the pregnancy or labor or delivery, where it can be transmitted from mother to the child, or even during breastfeeding, since breast milk can significantly contribute towards the transmission of HIV virus, and also through pre-mastication, or a process where the mother chews the baby food just to soften it before feeding it to them. So finally, we have an exposure of blood of someone with HIV through using a non-infected or a contaminated needle during blood transfusion process, etc. All of these are the most common ways in which HIV can spread. And once HIV infection occurs, we should also keep a focus on the symptoms and effects of HIV infection. Generally, as I mentioned earlier, the stage 1 and stage 2 of HIV infection are not as characteristic as the stage 3, that is AIDS. Because here, during AIDS, there is occurrence of opportunistic infections, and there is an increased risk of many infections that may occur, and this includes Mycobacterium tuberculosis infection as well. Or also there can be herpes virus infection, that is particularly like a particular strain of herpes virus called the cytomegalovirus that can be observed. And in a general scenario, there are problems with eyes, lungs, and digestive tract that is observed. Moving on further, there is also a particular type of cancer that is associated with AIDS, and it is called Kaposi sarcoma, which is a cancer of the blood vessel walls. It is, although a rare phenomena that can occur among general population, but it is common in HIV positive individuals. And the symptoms of Kaposi sarcoma are that there is occurrence of red or dark purple lesions on the mouth and skin, along with problems in the lung, digestive tract, and other internal organs. Additionally, apart from Kaposi sarcoma, the patient may also have a higher risk of developing lymphoma, and it is characterized at early stages by swollen lymph nodes. All of this indicate, apart from this, there are various other opportunistic infections that can occur in AIDS that include pneumocystis carni pneumonia, or the PCP, the pulmonary arterial hypertension, or PAH, oral thrush, oral hairy leukoplakia, HIV-associated neuropathy, or HIV, Toxoplasma encephalitis, molluscum contagiosum infection, eczema, scabies, cryptococcal meningitis, seborrhea dermatitis, and even melanoma. Melanoma is the cancer of the skin. So, in order to diagnose HIV infection, there are three different tests that can be carried out. The most commonly used test for HIV infection analysis is the antibody or antigen test, where it can show positive results typically within 18 to 45 days after someone is infected with HIV. The antibody antigen tests are classically carried out using the enzyme-linked immunosorbent assay technique. And next, there is only a particular antibody test that is carried out between 23 to 90 days after infection. This is because most people will develop detective HIV antibodies during this time period, and these antibodies can be categorically found in the blood or saliva. So these are the common confirmatory tests that are used for HIV diagnosis. Also, we have the nucleic acid test, which is an expensive test, and it is not used for general screening. But however, it is used in only those with early symptoms of HIV or who are known to have a risk factor, like maybe they had an unprotected sex with somebody who is HIV positive or a stranger, etc. And if that person believes that he or she might have contracted HIV infection, then they can undergo a NAT. And here the NAT looks for viral genetic material, which is generally detectable in the blood from the day 5 to day 21 of infection. After the NAT is done, the results are further confirmed by an antibody test. So this is how the diagnosis of HIV. Next, moving on to the treatment of HIV or AIDS. There is no particular cure for this infection or disease. However, there are many drugs that are available to control the virus, and it is, as I mentioned earlier, known as antiretroviral therapy or ART. In an event of infection, everybody who has been infected is recommended for ART, and it does not depend on the number of CD4 T cells present in that person. And generally, this recommendation happens in a combination of three drugs from two classes to avoid creating a drug-resistant strain of HIV. Here, there are different classes of drugs that are used to treat HIV infection, and each class of the drug blocks the virus in different ways. So, talking about the classes of anti-HIV drugs, they include the non-nucleoside reverse transcriptase inhibitors, or the NNRTIs, which turn off a protein that is needed by HIV to make the copies of itself. The examples for NNRTIs are efavirenz, etravirine, nevirapine. Then we have the NRTIs, or the nucleoside or nucleotide reverse transcriptase inhibitors, which are faulty versions of the building blocks that are needed by the HIV to make a copy of itself. The NRTIs include abacavir and combination drugs such as emtricitabine or tenofovir, Tescovy, and lamivudine-zidovudine combinations. Then we also have protease inhibitors that inactivate HIV protease, which is another protein that the HIV needs to make copies of itself. The examples for protease inhibitors are atazanavir, duranavir, fosamaprevir, and indinavir. At number 4, we have the entry or fusion inhibitors that block HIV's entry into the CD4 T cells. The examples for such inhibitors are enfivirtide and maraviroc. Finally, we have the integrase inhibitors, which are a class of anti-HIV drugs that work by disabling a protein called the integrase. This integrase protein is the one that is used by HIV to insert its genetic material into the genetic material available in the T cells. The examples of integrase inhibitors are raltegravir and dolutegravir. So with this, I would like to conclude today's lecture. If you have any doubts, you can always write back to me. Thank you.